Hello everyone, I'm Dr. Amel Elfaramawy, Professor of Pediatrics at Chance University. This is your second lecture in the series of lectures about liver disease in children. The liver may be exposed to different injurious agents, whether infectious, immunologic, metabolic, vascular, toxic, etc., that will all lead to inflammation. If the injury is acute and the damage is reversible with no consequences, as for example in hepatitis A, this is called acute liver disease. If the damage is persistent for more than 6 months, as in case of hepatitis C or autoimmune hepatitis, this is a chronic liver disease, which will eventually lead to fibrosis and cirrhosis. But you have to know that there is a considerable overlap. Sometimes a chronic disease presents for the first time in an acute form that's unresolved and progress to be chronic persistent pathology, and sometimes, on the other hand, there may be acute injury on top of chronic disease. In this lecture, you will learn the acute presentation of liver disease and its complication, which is the acute liver failure or fulminant hepatic failure. By the end of this lecture, you will be able to identify the causes and clinical presentation of childhood hepatitis. You will be able to approach a case of hepatitis, to compare causes of viral hepatitis, to recognize the metabolic liver disease, to describe autoimmune hepatitis drug-induced liver injury, to describe the vascular liver disease, and to recognize acute liver failure in children. Hepatitis is an inflammation of the liver that can be due to infectious causes or non-infectious causes. The infectious causes may be viral, bacterial, fungal, or parasitic infection, and the non-infectious causes may be immunologic, metabolic, drug-induced, toxins, or ischemic. Viral infections are the most common causes of hepatitis. It may be due to hepatotropic viruses, which are viruses with special affinity to the liver. They are from A to G. Viral hepatitis is considered a major global health problem, or it may be due to non-hepatotropic viruses, which are basically causing systemic illnesses in which the liver may be involved, as in infectious mononucleosis caused by Epstein-Barr virus or cytomegalovirus. Hepatitis can occur as a part of systemic bacterial infectious disease, as in typhoid fever, brucellosis, tuberculosis, or in case of sepsis. Also in systemic fungal infection, as in candidiasis, or parasitic disease, as in toxoplasmosis or malaria. Actually, you cannot distinguish the cause of hepatitis from the clinical picture, as it is the same whatever the cause. So you should confirm or exclude viral infection by doing viral markers. If not positive for any, you should think of other causes of hepatitis that could be autoimmune, metabolic, or drug-induced. This algorithm shows how to approach a suspected case of hepatitis. Well, this is the end of the first segment. You know now that hepatitis can be caused by different infectious and non-infectious causes. In the next segment, I will focus on viral hepatitis A, B, and C in children.